Excellent. Thank you, marketing external. Very good. Right, let's start again. Take two. So hopefully now you can all see my screen. So as I say, this is our learning lunch. The subject matter this afternoon is the power of apps in patient care and staff engagement. And sorry to repeat myself, but yeah, my name's Chris Elkin. I've spent 20 odd years within the digital media industry. Spent 10 years working directly for the NHS, creating online learning content for colleagues, creating education for patients, creating systems for effectively managing sort of learning, and manage the Trust website and intranet, or teams of people that manage the Trust website and intranet. So quite well versed with how the NHS is using technology to engage and communicate and update audiences, whether that be patients, families, and carers, or citizens out there in the big wide world, or more closer to home, your staff within the organisations. At heart, I'm really interested in the user experience. It's all about, for me, it's about making things easy for people. The we're in the world, everything's a million miles an hour. It's very difficult sometimes for people to think and to look at information. So if we can make it easy for people, if we can sort of lay it out on a plate, make the navigation really simple, make the content concise and relevant, then I think we're always almost halfway there. So user experiences is really key to me and to our organisation. A little bit about Piota, big statement, but I think we can back it up. We're a leading provider of patient support apps to the NHS. We've got about 120, 130 apps out there now being used in the NHS and social care. We've got some really big clients. We work with NHS England, we work with Public Health Wales, we work with some cancer alliances, we work with lots of big hospitals and individual teams and everybody else within that spectrum. So we're working with organisations that want an app, that may or may not have the resources internally. So in terms of comms or in terms of IT, that can help them deliver this app. These guys have recognised that apps can play a massive part in engaging with their audiences. So they'll come and work with Piota. We've got an app platform, so we're not sort of your generic app developer where you kind of give us all of your requirements and we come back and build it for you. We've got a platform that can be very easily and quickly tailored to meet your requirements. So this is just a bunch of different apps for different organisations. Some of these are patient apps. The first one was a maternity one. I think that was a diabetes one. But you'll see some similarity between our apps. So at the top half of the screen, we've got some branding. Bottom half of the screen, we've got this menu system, which we call our tiles. And these tiles can have different icons and labels. The functions behind the tiles range from simple information pages with graphics and hyperlinks to different resources, to forms. So if you've used things like Smart Survey or SurveyMonkey, it's that sort of technology. You've got events calendars and contacts directories. So a whole plethora of functions that you can use to help engage or improve communication with your audiences. And I say I hesitate a little bit with audiences. Once upon a time, it was all patients, families, and carers, but more widely being used now for staff engagement. So being able to provide your colleagues with all the information they need in their pockets. You don't necessarily need to be in work, first and foremost. You don't necessarily need to be on a PC or a nurse's workstation to access some of this content. It all can be done on your phone. I don't know about you guys, other than at work, I'm using my phone all the time. I use my computer at work, my laptop perhaps, for work-related purposes. But at 6 o'clock when I finish work, everything I do is on my phone. So, as a producer or as a supplier of information to your audiences, why wouldn't you want to use this medium? It's a little supercomputer that everyone's got in the pocket and using kind of all the time. So, bundle that with push notifications where you can give people a little virtual tap on the shoulder to let them know that something's happening. It's just a really great way of keeping in contact with your audiences. So this one's, I think it's from University Hospitals Birmingham, as it says on there. This is all their paediatric guidelines, and this is for all of their locums, all of their consultants, all of the junior doctors, all of the AHPs. Anybody that works within paediatrics can quickly pull out the phone at any point, go through the alphabet A to Z or in particular areas, and find that guideline, find that policy, and be familiar with its contents within seconds. And where we are a busy workforce and we're trying to see as many different people as possible. Having that information at your fingertips instantly, is a big win for a lot of teams. We've done work with lots of different organisations, as I mentioned earlier. So we've been doing work with different care homes. So being able to provide staff with information about the different resources that are available, whether it be training, whether it be policy procedures, a whole heap of different areas, or whether the care homes using the app to be able to engage with families and carers. So to let people know what's been happening within the care home today, and what other events are happening, and what other things are going on. So again, it's just a great way of adding an additional resource to your communications tool bag to be able to really reach out and engage with your audiences. So there's a whole bunch there of different apps for different purposes. I'm going to get into a bit more detail now and just show 3 or 4 different apps and just show the sorts of information that people are using. Just keep in mind that we're not subject matter experts. We've got a platform here, we've got the expertise, we've got the experience, and we'll guide you through this process. But all of the content is driven, is produced, is managed by the partner. So in this first one, we're talking about patient experience. So, lots of ways of, as I say, being able to reach out to people. We're doing lots of work with Macmillan teams at the moment. So those teams have been able to talk about the app and the patient, families and carers. And it's families and carers sometimes, I guess, that need the information just as much as the patient can then access the app and have all of the localized information. So these aren't generic apps that tell you everything about everything. These are very specific to that team, to that community, to that particular patient. It's very tailored. So when you're looking at these things, it all makes sense. You're not reading stuff that isn't really relevant. It's all been produced and managed by your care team, your trusted care team. So let's have a quick look at this one. This one's for a hospital up in the northwest. So this is all about maternity, so aimed at new parents, grandparents, significant others. And again, as I said before, sort of logo, colours, and these sort of tiles are all custom for the different organisations. But this is around maternity, so lots of information out there. So right from the get-go, you just found out pregnant, there's a referral form, and that can be completed very, very quickly and easily on your device. So again, we're just creating efficiency. We're making it easy for people to be able to start the process rolling. This one's a simple signposting type screen, which signposts them to different YouTube resources. And again, with these apps, what we're not wanting to do is reinvent the wheel. There's tons of great content out there. We're just wanting to really signpost people. They've got a one-stop shop. They can come to this app whenever they want to, and it will tell them where to go, what to read, what's good, what's not so good, essentially. But just signpost you in these different areas for these different things. So it's just a great way, again, of just making it easy for people. And I think if you make it easy for people, they're more likely to do it. If they're more likely to do something, then hopefully that will benefit us in the long run, because they can take better care of themselves. They know what information they need. They're going to stop phoning you up with the same questions. It's just about providing them with that information in a quick and easy format. Because arguably all this stuff is potentially out there on the internet in leaflets and different areas. It's just so scattered. It's difficult to find it a lot of the time. So put it in an app. That's what Piota stands for. Put it on the app. Just makes it easy for everybody. So lots of great advice, lots of great information. This is a sort of contacts directory, and these are great because you can have all of the different contacts, all of the different suites. Potentially, again, this is up to you what information you want to provide, but with a quick click on the call button, it will take you through to that team, it will take you through to that department. It just makes life easier. If I can pull my phone out and I know what to go and speak to midwives, I'm not asking everybody always searching the internet trying to find it. Where is it? It's just a click on the button and you're speaking to them. So just a really quick, great piece of functionality. You've got push notifications and alerts. We talked about that earlier on. So those little sort of little messages you get on your phone and the little bubbles next to your favourite apps let you know there's something new. So if you wanted to keep people up to date about whatever might be happening, it's just a real quick, easy, and modern way of reaching out to people. Right, let's show another one. So this one's a one for a cancer or Macmillan Information Support Centre. Exactly the same principle. their colours, their branding. This is a picture of their information support centre, so they're looking to, bring some familiarity about who we are and where we are, so people, are comfortable. They can recognise the support centre. But in this instance, the tiles and the icons are slightly different focus for a different audience with different information. If we just get into this information about the support centre, what it does, how we can help. And again, this is given out at initial diagnosis, not a prescription as such, but just we've got this great app. Everything that you're going to need from here on in is in the app, and you feel ready, then please download it, and please provide it to your nearest and dearest, because there is lots of great information on here. And as I say, I think with some of these things, it's it is down to the carers, isn't it? If they're aware of what's happening, they're aware of the different events that are happening within the community, they can help as well, can't they? They can help to motivate mum, dad, sister, brother to attend some of these things. So all this information is available to all of the people involved. So this one, I think, there's a picture there of traditionally all the patient information leaflets all stacked nicely on the shelf. But within the app itself, you can access any of these just within a couple of clicks. All of those are links to Macmillan websites, and you can just go and click on them and have a little read, little nosy. Stuff like buddy support. Again, these are local initiatives to this particular area. They're not generic across the country. It's very much information that's focused for people living in North Derbyshire, living in Chesterfield, around those areas. This particular one, or I should say all of our apps, come now with the ability to translate into different languages. So, if English is not your first language, again, with some simple instruction, you can change the whole written text of the app into over 120 languages. This is supported by Google Translate. So a couple of quick clicks on the app, and it will, as I say, turn that into whatever language it needs to be. And again, that can be of great benefit, especially with multicultural communities. Again, this can really help people to understand what's on offer and how to access different services. It can reduce the time of translators and such like. So it begins to start to try and at least attempt to try and level off the playing field in terms of making sure everyone's got the same access to the same information. I think that's important. That everyone's got access to the same information. We'll come back to that later. Again, same sort of principle here. They've got a contacts directory with addresses in this particular instance, or emails. You can have links to the different websites. You can put maps in there and stuff. Again, so as a user, I can put on my phone, go to contacts, and find a map of how to get there, or be able to speak to them directly. It's just a simple way of providing this really useful information to your patients, their families, and carers. Let's have another look at another area then. Let's look at sort of staff engagement. So same platform, just being used in a slightly different way. And we're finding more and more, the more we speak to different organisations, this imbalance of being able to access information. So if you're working in an office, then you've perhaps got your own computer and you can log into the internet at any time you want to be able to get this information. But for a lot of clinical staff, that may not be the case. And I know that the NHS, we talked about people's promise, ensuring we look after one another, ensure that everyone's got equal access. But again, if you haven't got the time and the ability to interact with the intranet, then there might be lots of great work opportunities, networking opportunities, financial benefits that are all published, but they're not visible to you. You just can't see them unless you're sort of hanging around trying to get on the computers, at the end of the day. So having something again that's on your little supercomputer that's in your pocket, where your colleagues can access this whenever they want to, wherever they want to. Again, it's just about equaling things up for people, isn't it? Giving people the same opportunities, using technologies that everyone's got and everyone's using all the time. So this one's a staff engagement app, and this one was created just after COVID had sort of happened to us. So it was about, I think that COVID was the point that sort of, we're going to do this now. We need to do this. But this particular app, staff engagement, And this is aimed at all staff within this particular hospital. So everything they need to know, everything, all the information about resources, jobs, where you work, induction materials, benefits, calendars of events and different things that are happening, well-being information, all in one place. So at any point, pull this out, quick click into one of these different categories, and you're retrieving that information. So as I say, there was information about different things that are happening throughout the trust itself, different networks that were available. And for a lot of the staff, that didn't have access to the internet, some of the feedback was, they didn't know about some of these things. They were very interested in attending, but it was just invisible to them. Information about the different systems that you're using. So if you are working from home, if you have that ability to be flexible, there's links to Teams, links to Outlook, links to ESR, links to different operational platforms that with instructions on how to do it, and more importantly, if you're struggling, who to go and speak to. So just providing everybody with that information, to be more flexible to work wherever they may want to. Information on benefits, and again, in the world that we live in at the moment, every penny counts. So if you can save a few quid, why wouldn't you? But for a lot of people, just weren't aware of it. They weren't aware that their local pub, restaurant, eatery, garage provided discounts. So be able to put that sort of information onto the app and being able to distribute that information to their colleagues was priceless. Again, the alerts, just to keep everyone up to date with everything that's happening, really, really good. I like this. I love this, in fact. I think I said before, we've got the ability within the app to have a forms or a surveys type function, but they were using this thing called a pulse check, again through the pandemic, but using the app to be able to just send out 2 or 3 questions, very similar to what you guys all experience within the NHS staff survey, but just breaking it down into smaller, manageable bites of information. So a little alert went out. Could you take 2 or 3 minutes just to complete this little sort of pulse check? And it was exactly that. It was the organisation just reaching out and finding out how people were feeling. Have you got the right information? What's leadership been like? In some clinical systems, have you got the right PPE? Have you got the right training? Are you confident? But just enough that they could go out, distribute this to everybody with a little push notification, get people to fill these different things in, and then within the back end of the system, be able to go analyse, kind of what's happening, and see where, good practice was, and, where perhaps poor practice was taking place. And, there's some of those instances, obviously, they can get transformation leads in there to go and stub them out before they turn into sort of big issues. But it's just another way of using, the forms and surveys, and they're being used for all sorts of different purposes. So in a lot of the patient apps, it might be sort of referral forms or requests for further information. It might be friends and family type scenarios. Would you recommend our service to your nearest and dearest? But it's that sort of approach. You've got a form or a survey tool, and you can use that for a whole host of reasons, depending on your app, its usage, and who you're reaching out to. So yeah, just another great way of really being able to engage with people. The last case study, if you will, at the show today is about increasing information efficiency. And this one's for another trust in the West Midlands. But this one was developed by or imagined by the lead consultant in the ED team. And what he was observing was some of his workforce. And the workforce, whilst they did have permanent workforce, they were scaffolded or held up, a little bit with locums and junior doctors and medical students and things. So all, capable of doing the job and being able to triage patients, but perhaps weren't 100% with the way that Dudley did these different things. So, as talking a step back and sort of observing, the system in flow, could see people having to sort of make, excuses to leave bedside, drawing the curtain behind them and ring up to the nurse's station to get to the internet to find the policy about this, that, or the other, in order they could just ensure that they were giving out the right advice or doing the right thing in conjunction or in accordance with the local policies and guidelines. So not the generic stuff, but how they did it here at Dudley. So as you can see, with the menu, adult guidelines, PED guidelines, policies and procedures, and of course now he's got this kind of there's a whole heap of different functions that can sort of come out of this. So let me show you what he's kind of been up to. This one is closed. I think the STHK, the previous one, the staff engagement one, elements of that are closed. And what does that mean? So with the patient apps, you want to just promote that to everybody so everybody can download it, use it, no issue. With some of these sort of staff apps, with the staff engagement app, some of that was open, so Go Public can still download it and see what a wonderful organisation they were. But when it kind of got into the nitty-gritty detail, you had to register to be able to access that content. And similarly to this one, there's nothing here that they probably wouldn't want Joe Public to look at, but there's plenty in here they probably didn't want Joe Public to look at. So before you get started, you have to kind of register with the system, and once it knows that you are part of the team, it will let you in and you can see the content. But this was just a list of all the different policies and procedures, and clicking on any one of these things would bring up the resource immediately to you. And again, these are the paediatric guidelines, all breaking up into different areas. You can go into one of these categories, you'd have a list of the different guidelines, and with a couple of clicks it could be open and you could be just having a quick look and just updating yourself about how we do it here. So yeah, only saved 3 or 4 minutes perhaps, for that person to kind of dash off to the nurse's station and tap someone on the shoulder. Do you mind if I just get on there and have a quick look, and then dash back and then go and speak to the patient? But 2 or 3 minutes here, 2 or 3 minutes there, it soon mounts up. Over a period of time, they were making considerable savings just by making that information more accessible, by providing it at the place of work, within that person's hand, whilst they're having the conversation, whilst they're going through the triage. They can be updating themselves on how we do it here, and it's all a lot easier. So just a very simple app. Just brought a lot of benefit there in terms of time savings and and public health, essentially, isn't it? You can see more people. It's got to be a good thing. So he's put stuff on there like the rota. Again, thinking about his colleagues, what do they want out of this app? Obviously, we're using it for operational purposes, but there's a human element to this as well. We've got people using it. Can we put things on the rota on there? Can we have training on there? This one's a bunch of forms. So lots of different things here operationally. Leave request forms again. If you want to take annual leave, there's probably a form on the internet that you need to go and fill in. It's on your phone now. You can fill this on the train going home. Handover sheets. So again, trying to reduce some of that paper or some of that process of taking handovers and sending that to people. But it's all done with the app now. You quickly update a few fields, press the button, and that then goes through to the relevant person who can sort of store, access, and do anything else with that sort of thing. So just a whole heap of different forms, different things are available. A directory, all the different consultants, all the different outpatient clinics, all the different community services and partners that they may need to be involved with. So again, rather trying to find that that sort of coffee stained bit of paper stapled next to the computer, just everything in one place. Click a button, you're speaking to that person, or speaking to the secretary, or speaking to that provider in the community. It's just making the people's lives easier. Really is. Yeah, all the mandatory training. So put the training on there again, just making it easy for people. You need to do training. You've not always got time to do it. I think from my background, a lot of the time, especially with mandatory training, people don't really know what's expected from them. So, for someone to be able to spell out, this is what we expect of you, this is where you can access it, and click a button on your phone to go and access e-learning for healthcare, or access some internal communications or internal training. It's just that easy, really easy. And so on and so forth. So that's a selection of apps just to sort of show you, it's the same platform essentially. It's really versatile and it can be used in lots of different scenarios. So let's just talk a little bit about the app before I end. What time? We've got 12:56. We're sort of on time. So 2 elements. Obviously, you've got the phone element, and that's distributed to your audiences, but you've also got on the left-hand side there a content management system, and it's super easy to use. I always jest a little bit when I'm delivering training, prepare to be underwhelmed, which is a good thing, because it's that easy. You've got some icons at the top that represent the different icons on the app itself. Clicking onto one of those icons opens up a little sort of editing window, where you can add your graphics, you can add your text, you can do some formatting, you can create those links to those different resources. So whether they be information portals, whether it be websites, whether it be the front doors of your ESR system or another system, you provide this little editor, all of the functions you use, I say you probably use, your administrators use all the time within Word and PowerPoint. So the learning curve is shallow, the remembrance curve is shallow. So, within 15, 20 minutes, you're creating content. And when you press of a button, you published it, that goes across to your device with a push notification telling you that something's new. Click on this button to find that kind of new information. So really, really simple. And again, that's part of the beauty of the platform. It's simple. It works. It's tried and tested. And tons of people out there kind of using it. So really, really good. So process, what happens next then? So if any of you guys would like what you've seen this morning and want to reach out to us, we can have that kind of initial conversation. We can talk about what it is, that's on your mind. Well, we're thinking about this app for patients, or would like to be a bit more efficient in this particular area. We can have a little honest, open conversation about it. There's a likelihood, not always, that somebody else has had that same thought in the past, and we'll have something to demonstrate about how they're using the app to overcome that particular challenge or obstacle. We can produce, in a lot of instances, if you're genuinely interested, we can produce a free trial. So we can create an instance of the app. You have come to speak to us. Obviously, you've got a vision how this might work, but in a lot, if not all instances, it's not all about one person's vision. It's about this person wanting to improve, whatever this might be: patient experience, efficiency within the team, accessibility to information. Being passionate about it. And then the next step would be, well, I need to go and then speak to my team about that, or the leadership team, or I need to go and then get some kind of funding. So what we can do is we can take those key objectives, those key elements, and produce a free trial. You're going to be telling a story at some stage, and we'll sort of, act as your picture person. We'll create a trial app with some of this information in here. So when you're talking to people, you can be pressing the buttons, you can be showing them and telling them how to download it, and they can see how this thing works and how it would fit together. So yeah, would be your illustrator, I suppose, by use of this free trial. The free trials run for 30 days. As I say, there's no cost associated with it other than your time. We'll invest time into it. If you're genuinely interested, we can normally get that from the conversations that we're having with people, and then help you through that process. And that's something we've done time and time again. There's not many people that come up to me these days and says, we want an app for this, and we've got a budget, a time scale, and we've got a panel of people. As I say, it's individuals a lot of the time that want to make a difference, that want to make a change, and we'll work with them to help them in any way that we can. So once we've created the trial app, you can then demonstrate that to your audiences, your colleagues, patients, perhaps a mixture of both. Some apps do have dual functions, so its primary use might be for patients, families, and carers, but you could have a restricted button on the side for your for your colleagues that could have things like pathways or contact directories, or patient information leaflets for those making every contact count scenarios. But what was producing in this context is a trial that you can demonstrate and start to sort of gather feedback from your different audiences. Beyond that, we can get everything kind of set up and get the sort of formal aspects of this out of the way. And that normally looks like you getting your agreement sort of from funding, where we will engage with information governance teams, and beyond that, it's about them providing you with training and kind of getting you kind of up and running. We can do all this relatively quickly. We've got a platform that's already created. It's waiting to kind of go. It obviously needs some customization to meet your needs. But here's a quote from a chief nurse that we work with during the pandemic. It seems like forever ago, it wasn't that long ago, that came to us and wanted to provide something for all of the healthcare workers in their care homes within the region. So they came to us in the morning with this idea, and by the afternoon, They were sending out emails to their managers who were sort of instructed to inform their workforce that we've got this new app now. You all need to download it. This is how you do it. This is how you access it. And then in that context, CCG had almost a direct link to all of the, the workforce, the individuals within the different teams, so they could keep them updated with the fast moving world we were in at that time. All about training and different PPE and the different processes and different protocols that were in place. So the point I'm trying to make is, we can do this relatively quickly. We can get these out the door relatively quickly. It doesn't need to be a long, drawn-out process. These things are relatively inexpensive. From my experience of working and trying to build teams with people that can build these things, or working with third parties that will do that with you, it can be a little bit scary because of the costs associated with it. This isn't expensive in the grand scheme of things. It starts from about £3,000 a year to about £10,000 a year, depending on how many users are accessing it. And again, we'll have a conversation about you and kind of work that out very early into the process. So I think that is probably me. I'm going to kill the PowerPoint for now and see whether or not we've got any questions from you guys. So does anybody have any questions for me, any comments, anything they'd like to share with the rest of the people while we're all here? Can't see anything in the chat. So if nobody does, I'm going to say thank you all for attending today. We will forward on a copy of this presentation, including a PDF with the slides. I do suggest, or not suggest, but I would ask if you want to share this with other colleagues that may or may not be looking at apps or wanting to improve patient experience, then please do, because we've got a lot to talk about. I think we've done lots of great work with lots of different teams. So we would welcome any conversations with any of your colleagues. So if there's no more questions, no more chat, thank you all for your time this afternoon. Do appreciate it, and hopefully we'll speak to you again soon. It's not always me, by the way. We do different events when I have different guest speakers coming in. So keep an eye on the socials, and we will be back in contact soon. But thanks again all for your time. Have a great afternoon. Bye for now.